almost everybody in the last 500 years developed a bad airway. Our jaws are too small. So it's so common. It actually should be something that we rule out. Does someone not have a bad airway? Right? Because what we know from anthropology and studies is that people have small jaws compared to what we had 500 plus years ago for thousands and thousands of years. But, you know, everyone looks at faces in the present. And even if you look at historical faces from ancestry, we're talking about 5 generations. We're only looking back several hundred years. And even though we think it's historic, it's a little timestamp in the history of man.
Fingernail.
It's a fingernail, right?
Yeah.
So it's like if you zoom out and the evidence is there, it's not controversial at all. This stuff's been documented, studied, accepted for hundreds of years. Major institutions, Stanford, Harvard, not only the US, but in Asia, Europe. There's evidence that the skulls 500 plus years ago, pre-industrial and agricultural revolutions, that there were changes in the facial development.
Yeah,
the faces are shrinking. They're getting smaller. So we know that, but what people still up until recently really never put together is what that means besides having smaller faces.
Besides an aesthetic difference.
Besides an aesthetic difference, and it's not an anecdotal difference. It's not just trivial. It has significant impact on our health, and we accept 90% of the population to need or not need or benefit from braces or orthodontics, right? Almost everyone you know had braces at some point in their life, and that's because they had crowding in their teeth. But why do people have crowding? They didn't have crowding 1,000 years ago. Not only they didn't have crowding 1,000 years ago, they even had room for 32 teeth to erupt. Mm-hmm. They had room for their wisdom teeth. Now we just kind of accept that everyone needs their wisdom teeth out, and that's fine. But we got to think about why is that, and was that always true? And the answer is no.
No, of course not.
Yeah.
Yeah, the wisdom teeth aren't vestigial organs.
Correct.
Right? They're not just a leftover from our evolutionary
Correct. It wasn't
past.
a mistake.
Yeah, it wasn't a mistake.
It wasn't a mistake. We were designed to have these teeth. We weren't designed to have limited room for them. Yeah. And it's not, and it goes past the teeth. It's not just the teeth that are become a problem that we need braces for. We need to remove teeth. But then what does it happen? What happens to the nasal passages, which sit on the upper jawbone? How many people end up going for a septoplasty, turbinectomy, rhinoplasty to breathe better through their nose, thinking it's a nose problem, when what we really understand is it's a jaw problem. Mm-hmm. The jaws are recessed, narrow, so the internal nasal structures that are sitting on that jawbone are confined, restricted, and
they get compressed.
And they get compressed, and people are getting the wrong procedures.
Right.
Because
a deviated septum, if the palate is narrow, that means it sort of grows up high and vaulted, and that kinks the septum. Is that what's going on?
Correct. Yep. The septum has no room, so it buckles. And then the turbinates, and then that buckling of the septum restricts airflow on one side or both, because oftentimes that buckle is an S curve of the septum.